Hi, I hope everybody's having a very good day. I am starting to enjoy making the videos. Its really purpose is to give information to my patients, things that we may talk about in the office or not even have time to talk about, things that I either believe in as health maintenance, disease prevention, longevity, or things I do myself or both. So this back here about red light and infrared light therapy, I thought it would be a quick and easy video, something I recommend to a lot of people. You may have heard of red light, infrared light therapy. The medical term is called photobiomodulation therapy. If you look up, there's in scientific papers, study it's used for treatments of certain medical problems. It's been discovered to be an amazing mitochondrial anti-ager, detoxifier, cleaves free radicals from attacking mitochondria, cleans up the mitochondria, lets them function better. Why is that important? Well, remember mitochondria are those little batteries of the cell. As mitochondria live and die, so do we live and die. So healthy, strong mitochondria are going to make somebody's cells healthy and strong, make the person healthy and strong, and vice versa. So I got interested in red light therapy several years ago, studying it, and now I've been using it for a better part of 2.5 years. The reason we don't offer it here in the office is because it's not about doing it once every week, like with the IVs, or every 2 weeks, or depending on what your treatment options are. Red light therapy is really, if it's done consistently on a daily basis, I should say red and infrared light, on a daily basis, it will improve many things. We have some things here written here, thanks to Nancy, writing them up here. I will tell you that there's some very simple and easy to read books on Amazon regarding red and infrared light therapy. I recommend a company called Joovv, Joovv. That's probably the best company in the world making red and infrared light devices, joovv.com. I actually use a device called the Joovv Solo, which is a moderately priced device with a 50,000 hour longevity, which is maybe a once in a lifetime purchase. I do it daily. I usually do it 10 or 15 minutes on my upper body and 10 minutes on my lower body. There are some devices big enough that you can encompass your entire body if you have the room or care to spend the money to buy one of the larger devices. So a couple of reasons that I do it, and I'll tell you very simply in a practical terms, people like it very much right off the bat because it improves skin. If you have any wrinkles or any even pallor to your skin, maybe you're not in the sun enough, you're in the office, it's rejuvenating, better than any creams, and people notice it right away, almost within days, certainly weeks and months of using it. It's an amazing way to stimulate fat loss with having it on the belly fat where a lot of the fat pads reside. The mitochondria there are actually hungry, and if they're allowed to eat, they will eat, and they'll eat a lot of the fat and the things that sit in the fat, maybe heavy metals, maybe other toxins, maybe cancer cells. And so it's almost as if your body will eat itself for fuel. So it's a very efficient way of detoxification. And red light, in stimulating the mitochondria, stimulating the cleavage of free radicals, allows that process to be enhanced. I have a bad shoulder. Unfortunately, I haven't been able to play tennis in over a year. It's maybe surgical if people want to have surgery. I don't. Red light therapy, as well as doing certain exercises and stop doing certain exercises, has really allowed me not to even think about getting surgery and back to doing a lot of exercises that I'm able to do, even though it's not tennis. And a lot of that I attribute to consistent red light therapy treatment. As I said, you can look at these things. A lot of men enjoy it or utilize it for erectile function issues. Again, it's about blood flow, gets blood flow increasing into all areas of the body. Athletes use it before athletic competitions because it releases nitric oxide immediately, which enhances blood flow to all the organs, especially to the lungs and peripheral tissues. So there's a plethora of things. It's science-based. Obviously, having a red light device, I should have brought the one that we have here in the office in here so you can see what it is. There's really no downside. I don't believe, except you may have to wear sunglasses when you look straight at it. They give you a pair of glasses. I don't even use them. There may be, but there's no danger. There's no skin burning. You don't even feel anything really. And there's a lot of benefits to it. So except for a fasted exercise, in my opinion, this complement to my anti-aging and my longevity regimen is probably up there, even more important than some of the more esoteric things that I do. So red light, infrared light therapy, let's discuss it in here in the office. There's tons of stuff online on YouTube and other areas. You can look it up as a medical-based treatment called photobiomodulation. or just as red and infrared light. Hope that helps. Let's keep healthy. Looking forward to seeing you guys here in the office.